What is metabolic syndrome? Metabolic syndrome is a sum total of metabolic risk factors that can increase your chances of developing cardiovascular disease. And now you're probably wondering what those risk factors are. Well, there's a total of 6 of them that include abdominal obesity, elevated blood pressure, dyslipidemia, insulin resistance, being in a prothrombic state, and also being in a pro-inflammatory state. And the 2 most dominant risk factors appear to be abdominal obesity and insulin resistance. Thus, metabolic syndrome often precedes the development of type 2 diabetes. Now, how common is it to be diagnosed with metabolic syndrome? Well, in the US, it's determined that over 50 million Americans have metabolic syndrome, which increases their chances of developing atherosclerosis and possibly leading to coronary artery disease, stroke, and peripheral vascular disease. But how would you diagnose metabolic syndrome? Think of the diagnosis as a point system. The more points a person gets, the more likely it's possible they have metabolic syndrome. You get 2 points if you have family history of type 2 diabetes or past myocardial infarctions, 1 point if you have abdominal obesity or hip to waist ratio greater than 0.85, 1 point for elevated blood pressure greater than 140/90, 1 point for triglyceride levels exceeding 170 milligrams per deciliter, another point for a uric acid level more than 6.5 milligrams per deciliter, and 1 point for having a fatty liver or a positive ultrasound for fatty liver. With all the points added up, if you have 3 points or more, metabolic syndrome is possible, and having more points means there's a greater chance of having it. But how does someone develop these risk factors that can lead to metabolic syndrome? Well, one major reason is a sedentary lifestyle. Being sedentary increases your chances of hypertension, cancer, depression, diabetes, being obese, and others. Being obese and developing a high accumulation of adipose tissue also makes a person less sensitive to insulin, 2 of the most dominant risk factors in metabolic syndrome. Also, there is leptin deficiency. Leptin is a hormone produced in the adipose tissue, encoded by the obese gene or OB gene. Leptin signals the rostro-ventral-lateral medulla that controls sympathetic activity and the hypothalamic area that controls appetite and metabolism. With leptin deficiency, a person develops extreme hunger, which leads to chronic excessive eating and obesity. But there is treatment. You should reduce cardiovascular disease risk factors by stop smoking and reducing LDL cholesterol, reduce blood pressure, and getting glucose levels to a normal level. Try to achieve a BMI less than 25. A good goal is 30 minutes of moderate intensity activity 5 days a week and develop healthy eating habits to reduce the intake of saturated fats, trans fats, and cholesterol. Regards go to Dr. Strauss of the University of Iowa for giving me this information and knowledge that made it possible to create this video.
Powered by video.